Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
Okay, so we're going to talk about Hashimoto's and heart problems. This is kind of an interesting one, and I'm going to speak to you strictly from experience on this, because a lot of people are looking for like, oh, it's causing this exact thing to the heart, and it's creating the Brundle branch to not work right, and blah blah blah, and all that type of stuff. But I'm going to tell you the nuts and bolts, blue collar aspect of Hashimoto's and heart disease. So I've been doing this for a long time, seen thousands and thousands and thousands and thousands of patients. And here's what I hear. I have heard this. I am going to greatly downplay how many times I think I've heard this. But I have heard this somewhere between 500 and 1,000 times. And I think probably more. But this is how common it is. The patient comes in, and maybe they don't even know that they have autoimmune disease at that time. Maybe they don't even know that they got a thyroid problem at that time. And so you're sitting there listening and digging and taking notes and trying to go, okay, what's going on here? Does this person like fit my practice? Do they have autoimmune problems? And then it happens. Then they go, well, do you have heart? And then I ask, do you have heart palpitations for no reason at all? Heart palpitations or anxiety for no reason at all? Would you call that like PVCs, like preventricular contractions? Would you call that SVPs? These are all medical pathology that cause your heart to beat out of your chest. And I'm like, well, tell me more about that. Here's the story. I was under a lot of stress, and then all of a sudden, for no reason at all, my heart started to like really pound, and I really started to get big time arrhythmias, and I couldn't breathe very well, and I was really getting anxiety and so on and so forth. So I went to the hospital. And then they did an EKG, they did an echogram, they did a cardiogram, they did everything, and everything was normal. For the lucky ones. And everything was normal, and they told me to go home, and they told me to like take some electrolytes, and that I'm probably just stressed, and maybe I just need to deal with my stress and go to counseling. But if it happens again, maybe you can go to a cardiologist, even though everything was normal. The second person who's not always quite as fortunate, they'll pick something up. They'll pick something up on some of the electrical diagnostics, and they'll go, okay, we're going to go in and we're going to ablate. We're going to ablate the nerves that are causing your heart to do that. And then they do that, but the patient's still sitting in front of me with heart palpitations for no reason at all. And anxiety for no reason on those types of things, even though they've been ablated. Okay. So this, when I see questions that come in on does Hashimoto's cause heart problems, technically the answer is no. However, not technically the answer is yes, and here's how it happens. Basically, it's real simple. Your heart, nature kind of knows that we need our heart to keep beating. It kind of intuitively knows that that's an important thing. So it's put like many, 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 many times more receptors for thyroid hormone on your heart than other organs, than other cells. Every cell in your body has a receptor site for thyroid hormone, but it's much denser in the heart. There's much more there because you need thyroid hormone, particularly the one T3, to keep hitting that heart to make it keep helping to give it energy, along with the oxygen, along with blood sugar, along with those types of things. So when we get autoimmune thyroid disease, and you start triggering the disease from any of many triggers. Maybe it's a stress, maybe it's different types of foods that are triggering you, maybe there's chemicals that you're being exposed to, maybe you have one of the chronic viral infections, maybe you overdo it, maybe you overtry, and there's 40 some of these, okay? And you start doing those, and you'll start to set off immune inflammation, which will attack your thyroid. And a couple of things can happen. You can either start, if in certain situations you start making too much iodine, take too much iodine in the system, you make too much thyroid hormone, or you could just start destroying thyroid tissue. Either one of those is going to increase the amount of thyroid hormone that starts flying around in your system. And we go back to the fact that nature has provided us with a fail-safe mechanism for our heart by putting many more thyroid receptors there, and all of a sudden you start getting hit with a lot of thyroid hormone, and you start getting shaky and anxiety and heart palpitations. Now, if you happen to be stressed at that same time, if you happen to be stressed and putting out a hormone that's called cortisol, which everybody seems to be familiar with today, and that puts you into fight flight, the adrenaline and the adrenaline go, and then the cortisol puts you into fight flight, and then on top of that, you trigger your thyroid hormone and you start putting a bunch of thyroid hormone out on top of the adrenaline and cortisol, you may end up in the hospital with a heart problem. Okay, but it's not a heart problem. It's rarely a heart problem. It's I mean it's to the point today, and I know I'm talking to people, so I'm trying to be very careful, but this is what I see. Okay, so I mean it's to the point today when somebody tells me that they have Wolff-Parkinson-White syndrome, which is a very, 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 very rare syndrome. That means they're grasping for straws most of the time. I'm not saying it doesn't exist, but I'm just saying this is what I see. Okay, and or they come in and go, and I've got SVPs and my heart's pounding all the time, and they're going to ablate or they've ablated. I'm like, this person's Hashimoto's until proven it is. So that's the relation between autoimmune thyroid disease and heart problems. Now, if you were to look at the fact that Hashimoto's is called Hashimoto's hypothyroid disease, 90% of people have Hashimoto's have hypo. That slows your heart down and it makes you tired, but it doesn't really damage your heart. It's just your heart's just like going, give me some thyroid hormone, and it's just kind of slow. So I think that's kind of like the long and the short. That's the clinical, real life, in the office, what you're really seeing in a real life practice, heart connection to autoimmune thyroid disease.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.